What is TACE, chemoembolization for liver cancer? Have you ever wondered how doctors treat liver cancer when surgery isn't an option? One method they use is called transarterial chemoembolization, commonly known as TACE. This treatment is specially designed for liver cancer and combines two powerful approaches. First, it delivers chemotherapy drugs directly into the tumor, and second, it blocks the tumor's blood supply to make the treatment more effective. The liver has a unique way of getting its blood supply. Normal liver tissue mainly receives blood from the portal vein, while liver tumors primarily get their blood from the hepatic artery. TACE takes advantage of this difference. Doctors start by inserting a thin tube called a catheter through an artery, usually beginning in the groin. They guide this catheter to the hepatic artery that feeds the tumor. Once in place, they inject chemotherapy drugs right into the tumor's blood vessels. But that's not all. After delivering the chemotherapy, doctors introduce tiny particles or gels known as embolic materials. These materials block the blood vessels, cutting off the tumor's oxygen and nutrients. This dual action traps the chemotherapy inside the tumor, maximizing its effect while starving the tumor of what it needs to grow. TACE is typically recommended for patients whose liver cancer cannot be surgically removed or treated with other local methods like ablation. It is also a valuable option for patients awaiting a liver transplant. However, candidates for TACE must have good liver function and no significant complications, such as fluid buildup in the abdomen or blood clots in the portal vein. The procedure usually takes about 1 to 2 hours and may need to be repeated several times, especially for larger tumors or those located in both liver lobes. While TACE can cause side effects like fever, nausea, and pain, these are generally manageable with medication. It's important to note that TACE does not cure liver cancer. However, it can help control tumor growth, relieving symptoms, and potentially extend survival. In some cases, it may shrink tumors enough to make surgery possible later on. Because TACE targets the tumor directly and limits the exposure of chemotherapy to the rest of the body, it serves as a crucial treatment option for liver cancer when surgery is not feasible. If you or someone you know is considering TACE, it's essential to discuss this treatment with a healthcare team. They can provide valuable insights into the benefits, risks, and whether TACE is the right choice for the specific medical situation.